Cranial nerve testing is very important because you will see it all over the exams and exam makers love to ask about them. We're going to start by olfactory nerve, which is cranial nerve number 1. And this is rarely done. Basically, you're going to test the patient's smell by putting something very potent, like coffee beans or lemons, for example. And it can be negative in cases of nasal infections, allergies, nasal polyps, or Parkinson's disease. Cranial nerve number 2, the optic nerve, can be tested by 3 main things: the visual acuity, the visual fields, and the light reflexes. However, you should complete your examination with a fundoscope. Look for any papilledema, retinal hemorrhage, or anything abnormal in the eyes. Cranial nerves number 3, 4, and 6 are all tested together because they all share the same function of controlling the eye's movement. These are the oculomotor, trochlear, and abducens nerves. You can ask the patient to look straight ahead and move their eye in the shape of the letter H. So they're going to move it side to side and then up and down. The third cranial nerve, the oculomotor, is especially important as it also controls the pupil's contraction. So oculomotor nerve compression, which is mostly occurred due to posterior communicating artery aneurysm, can cause pupil dilation, ptosis of the eyes, and outward and downward eye positioning. This is how you're going to do the testing. You can ask the patient to look at your finger while fixing their head, and you're going to move your hand right to left and up and down. Cranial nerve number 5, or the trigeminal nerve, has many important functions. Firstly, it controls the chewing muscles, so you can ask the patient to clench their teeth or to chew a gum. And it also controls the sensation of the major parts of the face. The eyes, for example, can be tested by placing a cotton tip on the side of the sclera of the patient's eye. The same or different cotton tip can be used to test the sensation of the face and the forehead, around the cheeks, and the jaws. The corneal reflexes should occur when you touch the sclera. If it doesn't, it can be a sign of a brainstem lesion or brain death. Facial nerve palsy is very important and very common. The facial nerve innervates the muscles of the face and the stapes, which is in the ears, and it controls the volume of the sound. So if this muscle is defected due to some facial nerve problem, the patient can have some hyperacusis, which means that they have perception of the sound being louder than it actually is. To test for this nerve, you can ask the patient to raise their eyebrows, and you can do this with or without resistance, or to close their eyes against resistance. You can also ask them to inflate their cheeks or smile wildly. If the patient has some weakness in the face, we're going to look at the forehead. If the facial weakness does not involve the forehead, the problem is likely to be in the contralateral side of the head. So look at strokes or some cerebral issues in the contralateral side. But if the weakness involves the forehead, the problem is likely to be in the lower neural pathway in the ipsilateral side. The vestibulocochlear nerve is very important for hearing and balance. You're going to perform 2 very important tests, the Weber and Rin tests. And I'll have a video after this one which explains these in detail. If air conduction exceeds the bone conduction, this is normal. But if bone conduction exceeds air conduction, this is likely to be sensorineural hearing loss. Cranial nerves number 9 and 10, the glossopharyngeal and vagus nerves, are very important. Notably, they innervate the pharynx and the posterior third of the tongue, while the vagus nerve also supports the larynx, the pharynx, and the gastrointestinal functions. If the patient cannot do some coughing reflexes or cannot gargle some water, or if they have some swallowing problems, this can indicate problems with these nerves. Additionally, you can ask the patient to say the word "ah" and look for uvular deviation. The uvula will deviate to the side opposite of the problem of the vagus nerve. The accessory nerve, number 11, supports the thoracic, the back, and the shoulder muscles. Simply ask the patient to shrug their shoulders and you can do this with or without resistance. You can also ask the patient to move their head from side to side as if they are saying no. And finally, cranial nerve number 12, the hypoglossal nerve, controls the movement of the tongue. So ask the patient to protrude their tongue and look for any problems like atrophy, fasciculation, or deviation.